Hello and welcome to SENDIAS Leicester. Social care. Would you like to know more about social care support for you and your family? Would you like to understand how to access support? And would you like to understand more about the transition to adult services? Local authorities have a legal responsibility to help families with disabled children. Many children have additional needs and disabilities, and some are more severely affected than others. Some disabled children, their parents or carers and siblings will need practical support both inside their home and outside it. Social services departments of local authorities are legally responsible for arranging support for disabled children, their siblings and their carers. You have a right to have your child and family's needs assessed by social services. The legal duties of social services to disabled children and their families include maintaining a register of disabled children, providing information about services which may be available, assessing the needs of disabled children and their carers, and providing a range of services to meet these needs. Social services responsibilities. Social services departments have a general duty under Section 1710 of the Children Act 1989 to safeguard and promote the interests of children in need and to promote their upbringing by their families. The law recognises disabled children as being in need. Children in need are defined as children who are under 18 years of age and are unlikely to achieve or maintain or to have the opportunity of achieving or maintaining a reasonable standard of health or development without the provision of services by a local authority, or whose health or development is likely to be significantly impaired or further impaired without the provision of such services by a local authority, or are disabled. Definition: disabled. Section 1711 of the Children's Act 1989 states that a child is disabled if they are blind, deaf, non-verbal, suffer from a mental disorder of any kind, or are substantially and permanently handicapped by illness, injury, or congenital deformity, or such other disability as may be prescribed. Where a local authority is under a duty to undertake an EHC assessment, this will include a specific duty to assess their social care support needs. What support can the council offer? There are 4 levels of support you can access. The first one is universal support and services. Next is targeted support and services, short-term activity-based breaks. Then targeted support and services, medium to long-term activity-based. And finally, specialist support and services, including at home. Level 1. Universal support and services. The child or young person will have some additional needs and/or a disability. They can access universal services but may need some information about what is available. Information about universal and targeted services can be provided by contacting the Disabled Children's Service or the local offer. An assessment is not needed for you to receive information alone. Level 2. Targeted support and services. Short-term activity-based breaks. The child or young person will have additional needs and/or a disability. They will not be accessing any out-of-school activity and will need support to do so. The DCS will provide support to find and access one activity. Level 3. Targeted support and services. Medium to long-term activity-based. The child or young person will have additional needs and/or a disability, Plus, the child or young person will not be able to continue attending the activity without ongoing support. This may be a worker to support or a referral to a specialist service. Level 4. Specialist support and services, including at home. The child or young person will have additional needs and/or a disability, and the child or young person's needs are complex and having a significant impact on the family. These families are likely to be allocated a social worker or an occupational therapist. How do I ask for an assessment? You can contact the Leicester City Duty and Advice Service for a referral. Call them on 0116 454 1004. For more information about the Disabled Children's Service, you can email dcs@leicester.gov.uk, visit the Disabled Children's Service website, or call them on 0116 454 4710. How do I access these services? An assessment is the process social services use to gather information about your child and family, so they can make a decision about what help you may need. The process for carrying out an assessment is contained within statutory guidance, working together to safeguard children. This guidance tells local authorities what they must do to meet their legal responsibilities to families with disabled children. It's up to each local authority to decide how much detail is needed in each assessment, but the maximum time frame for any assessment is 45 working days from the date they get a referral. Preparing for an assessment. It can be useful to make a list of questions before you meet, and you are entitled to have a friend or an advocate there with you. The social worker may also want to speak to your child's health visitor, doctor, or school to help them get a full picture of their needs. What to expect at an assessment. A social worker will usually come to your home to talk to you. They should ask you for information about your child, for example, sleeping patterns, eating habits, how your child communicates, what activities they enjoy, and whether you have any other children to look after. Don't be worried about asking for clear information about the focus of the assessment. It is an opportunity to have a conversation about how to meet your child's needs, but do remember that the assessment should be based on yours and your child's needs and not based on services already available. What if an assessment has been carried out in the past? When services are already being provided, the assessment should be reviewed regularly. But if your circumstances have changed, you can ask for a reassessment or review in the same way you ask for an assessment. What if I am refused an assessment? If your child is disabled and in need of services, you can't legally be refused an assessment. You don't need to have a diagnosis for your child to get an assessment or help from social services. It can sometimes take time before a diagnosis can be made for a number of reasons. You are entitled to make a complaint and then go to the local government and social care ombudsman. Moving into adult services. Disabled people over 18 years old have their needs met by adult care and support. This means that a disabled child receiving support from children's services will be transitioned to adult care and support when they turn 18. In England, the rights to services and support for disabled adults and their carers are covered under the Care Act 2014. Provisions under the Act should ensure that there is no gap in services when a young person makes this transition. In Leicester City, the transition team works closely to ensure the move from children's disabled services to adult social care is as smooth as possible. For more on this, you can view the Leicester City Transitions to Adulthood Information Guide on their website. You and your family are entitled to a transition assessment if the young person is likely to have needs when they become an adult and require adult services. You also do not have to be in receipt of children's services to receive a transitional assessment. How does it work? You can request a transition assessment via an online form on the council website. The young person, parent, carer, social worker or other professional can start the process. Once the transition team has received a request, they will allocate your family with a worker. This worker will then visit you and your family, the school, and any other professionals involved in the young person's care. If support needs are identified, the social worker can help you and your family to arrange support. If you are not eligible for adult social care support, the social worker will instead signpost you on to other services, voluntary agencies, and support groups who can assist. Carers and young carers. Your needs as a carer. Any assessment of your disabled child should take into account the needs of the rest of the family members, including parents and siblings, and consider their needs as a carer and capacity to continue with caring. However, the aim of a carer's assessment is to give you a chance to tell social services about the things that could make looking after your child easier for you. This may result in getting services or direct payments to meet your own assessed needs. Examples of services that can be provided include emotional support, support to engage in work, training, education or volunteering, and access to some recreational activities. How to tell if you are a carer. You're a carer if you're looking after someone regularly because they're ill or disabled, including family members. Carers help with washing, dressing or taking medicines, getting out and about and travelling to doctor's appointments, shopping, cleaning and laundry, paying bills and organising finances. They can also give emotional support by sitting with someone to keep them company, and watching over someone if they can't be left alone. The carer's assessment. A carer's assessment focuses on the carers and their needs. The key 3 questions you will be asked are: 1. Are your needs the result of providing necessary care to someone? 2. Does your caring role affect your ability to achieve any of the outcomes? 3. Is there a significant impact on your well-being as a result of the above? Outcomes. Social services will assess if the carer's physical or mental health is or is at risk of deteriorating, or the carer is unable to achieve any of the following: carrying out any caring responsibilities the carer has for a child, other parenting or caring responsibilities for a child, providing care to other persons for whom the carer provides care, maintaining a habitable home environment, managing and maintaining nutrition, developing and maintaining family or other significant personal relationships, accessing and engaging in work, training, education or volunteering, making use of necessary facilities or services in the local community, including recreational facilities or services engaging in recreational facilities. For more and where to apply, visit the Leicester City Council portal. Outcomes continued. Wellbeing covers the areas below: personal dignity, including treatment of the individual with respect, physical and mental health and emotional well-being, protection from abuse and neglect, control by the individual over day-to-day life, including over care and support provided and the way it's provided, participation in work, education, training or recreation, social and economic well-being, domestic, family and personal, suitability of living accommodation, and the individual's contribution to society. Young carers. Young carers are children under 18 with caring responsibilities, and their rights to be assessed come mostly from the Children Act 1989 and the Children and Families Act 2014. A young carer probably cares for a brother or sister. They may do extra jobs in and around the house, such as cooking, cleaning, or helping someone get dressed and moved around. They may also give a lot of physical help to a brother or sister who's disabled or ill. Along with doing things to help their brother or sister, they may be giving them and their parents emotional support too. A young person or their parents can request a young carer's assessment to have a social worker assess the needs of the family. For more information about young carers and their rights, contact the Barnardo's Carefree Young Carer Services on 0116 286 7182 or email carefree@barnardos.org.uk. What help might you get after a decision about your needs? If the local council decides that you do have eligible needs, then providing you want them to, they have a legal obligation to meet these needs, subject to a financial assessment, and must draw up a support plan detailing how these needs will be met. It may be agreed that the best way to help you as a carer is by providing services directly to you, providing services to the person you care for, or a combination of both. The support plan. The support plan must include details of the needs identified in the assessment, which needs meet the eligibility criteria, which needs the local council is going to meet and how, the outcomes that you want to achieve, information about the personal budget available, which is the amount of money that the local council has worked out it will cost to arrange the necessary support for you, information about direct payments, information and advice to support you in your role as a carer and address your needs. For more information and examples, please see the Carers UK website. Leicester and Leicestershire-based organisations. The Big Mouth Forum, a group dedicated and run by children and young people aged 11 to 25 who have an additional need and/or a disability. Clasp the Carers Centre. This is a Leicestershire-based charity dedicated to supporting family carers who look after people with different needs. Flat 108, a safe place where young people can get some extra support to be more independent. Home Start Horizons, helping families in Leicester whose children are under 5 and require help and support. LAMP Carers Groups, a peer group advocacy where carers meet to share successes and discuss challenges in their caring role. Leicester Carers Support Service, support and information for carers over the age of 18. Leicester City Disabled Children's Services, support for disabled children, young people and their families run by the council. Leicestershire Centre for Integrated Living, a user-led organisation that supports disabled people to exercise choice and control for independent living. And the Parent Carer Forum, parent carers who have children aged 0 to 25 with SEND who live in Leicester City. National organisations. Barnardo's, protecting, supporting and nurturing the UK's most vulnerable children. Carers Trust, giving carers a voice and highlighting their work to the general public. Carers UK, they give expert advice, information and support to carers and those being cared for. Citizens Advice, They give people the knowledge and confidence they need to find their way forward, whoever they are and whatever their problem. Contact a family, supporting families that have a disabled child. Council for Disabled Children, umbrella body for the disabled children sector, bringing together professionals, practitioners and policymakers. Family Fund. Family Fund is the UK's largest charity providing grants for families raising disabled or seriously ill children and young people. Family Lives, a helpline for families to receive information and advice. Family Rights Group, they work with parents whose children are in need, at risk or are in the care system. The Children's Society, they work to empower young people to make positive changes and rediscover their hope. And Turn to Us, a national charity providing practical help to people who are struggling financially.